Hi everyone, welcome to our channel. In today's video, we're going to talk about a very important topic for our health: the top 10 diseases caused by viruses. Did you know that these microorganisms can cause anything from simple colds to more severe illnesses? Viruses are fascinating. They're these tiny little things that can really knock us down, but the more we know about them, the better we can protect ourselves and those around us. So, stick around until the end to learn more about this essential topic. We'll cover everything from symptoms and transmission to prevention tips. Let's get started. First up, we've got the flu, also known as influenza. This isn't just your average cold. It's a serious respiratory illness caused by influenza viruses that infect the nose, throat, and sometimes the lungs. I'm sure most of you have had a brush with this one. It's that time of year when everyone seems to be sniffling, coughing, and feeling downright miserable. It hits us with fever, cough, those nasty body aches, you know the drill. But it doesn't stop there. The flu can also cause fatigue, chills, and even gastrointestinal symptoms like nausea and vomiting. It spreads like wildfire through the air, especially when someone coughs or sneezes, and by touching contaminated surfaces. Just imagine how quickly it can move through a crowded place like a school or office. Now, the flu can really knock some people down, especially young children, older adults, and those with weaker immune systems. For these groups, the flu can lead to serious complications like pneumonia, bronchitis, and even hospitalization. That's why getting your annual flu shot is so important. The vaccine is designed to protect against the most common strains of the virus each year. It's the best way to protect yourself and prevent the spread of this contagious virus. By getting vaccinated, you're not just protecting yourself but also those around you, especially those who are more vulnerable. Think of the flu shot as your shield against the flu. It helps your immune system recognize and fight the virus more effectively. It helps your body build up immunity, so even if you do come into contact with the virus, you're less likely to get sick. And if you do get sick, your symptoms will be much milder. This means a quicker recovery and less time feeling awful. Remember guys, prevention is key. Along with getting vaccinated, there are other steps you can take to protect yourself and others. Wash your hands frequently, cover your mouth and nose when you cough or sneeze, and stay home if you're not feeling well. These simple actions can make a big difference in keeping the flu at bay. Next, we have COVID-19, a global health challenge that has impacted all of our lives. The pandemic has brought unprecedented changes to our daily routines, affecting how we work, socialize, and even how we perceive the world around us. This one is caused by a virus called SARS-CoV-2, which is highly contagious and spreads primarily through respiratory droplets. It primarily affects the respiratory system, leading to symptoms that can range from mild to severe. COVID-19 can cause a range of symptoms, from mild, like a cough and fever, to more severe manifestations. Severe cases can include difficulty breathing and pneumonia, which may require hospitalization and intensive care. It's important to remember that anyone can get COVID-19, regardless of age or health status, and it can be serious, leading to long-term health issues or even death in some cases. Now, we've learned a lot about this virus since it first emerged. Research and scientific advancements have been rapid and ongoing. We know that wearing masks, especially in crowded indoor settings, can significantly reduce transmission. Social distancing and hand hygiene are also crucial. And of course, vaccination remains our strongest tool against COVID-19. Vaccines have been developed at an unprecedented pace. Vaccines help our bodies develop immunity to the virus, making it less likely for us to get seriously ill, reducing the risk of severe illness, hospitalization, and even death. They are a key component in our fight to return to normalcy. It's amazing how science has helped us combat this pandemic. Through collective efforts, we continue to adapt and find ways to protect ourselves and our communities. Let's move on to hepatitis B and C, two of the most common viral infections that can severely impact liver health. These viruses are sneaky. They attack the liver, often without causing noticeable symptoms in the early stages. This means many people might be unaware they are even infected. Over time, though, they can lead to serious liver damage, cirrhosis, and even liver cancer. The damage can be extensive and irreversible if not detected early. Transmission usually occurs through contact with infected blood or bodily fluids. This can happen in various settings, including medical procedures and everyday activities. This can happen through sharing needles, unprotected sex, or any activity where blood-to-blood contact is possible. Additionally, an infected mother can pass the virus to her baby during childbirth, making it crucial for pregnant women to get tested. The good news is that we have effective vaccines to prevent hepatitis B. Vaccination is a powerful tool in reducing the spread of this virus, and for hepatitis C, while there's no vaccine yet, there are antiviral medications that can cure most cases. These treatments have revolutionized the management of hepatitis C. Regular testing is crucial, especially if you have risk factors for these infections. Early detection can make a significant difference in outcomes. Early detection and treatment are essential to prevent long-term liver damage. By staying informed and proactive, we can protect our liver health and overall well-being. Now let's talk about HIV, the virus that attacks the immune system, weakening the body's ability to fight off infections. If left untreated, HIV can progress to AIDS, a late stage of the infection where the immune system is severely damaged. HIV is primarily transmitted through unprotected sexual contact and contact with infected blood, such as through sharing needles. It can also be passed from an infected mother to her child during pregnancy, childbirth, or breastfeeding. While there's no cure for HIV, with early diagnosis and treatment with antiretroviral therapy, or ART, people with HIV can live long and healthy lives. ART helps to control the virus, preventing it from progressing to AIDS. Moving on to dengue fever, a mosquito-borne disease that's common in tropical and subtropical regions around the world. It's caused by the dengue virus, which is transmitted to humans through the bite of infected Aedes mosquitoes. Dengue fever can cause a wide range of symptoms, including high fever, severe headache, muscle and joint pain, and a characteristic skin rash. In severe cases, it can lead to dengue hemorrhagic fever, a life-threatening complication. Prevention involves protecting yourself from mosquito bites by using insect repellent, wearing long sleeves and pants, and eliminating mosquito breeding sites around your home. Next up is the Zika virus, another mosquito-borne illness that's a cause for concern, especially for pregnant women. Like dengue, Zika is primarily spread through the bite of infected Aedes mosquitoes. While Zika often causes mild or no symptoms, it can be serious for pregnant women, as it can cause microcephaly, a birth defect where a baby's head is smaller than expected, and other congenital disabilities in infants. There's no vaccine or specific treatment for Zika, so prevention is crucial. This includes avoiding travel to areas with Zika outbreaks, using mosquito repellent, and wearing protective clothing. Let's talk about chikungunya, another viral disease transmitted by the Aedes mosquito. This one is known for causing debilitating joint pain, often mistaken for arthritis. The pain can be so severe that it can make it difficult to walk or even perform simple tasks. Other symptoms include fever, headache, muscle pain, and a rash. While there's no specific treatment for chikungunya, over-the-counter pain relievers can help manage the symptoms. Rest and fluids are also important for recovery. Now, let's address herpes, a common viral infection that affects millions of people worldwide. There are two main types of herpes simplex virus, or HSV, HSV-1, which usually causes oral herpes like cold sores, and HSV-2, which typically causes genital herpes. Both types of HSV are highly contagious and can be spread through direct contact with sores or even through saliva or genital secretions, even when sores are not present. While there's no cure for herpes, antiviral medications can help manage outbreaks, reduce symptoms, and lower the risk of transmission. Next, we have measles, a highly contagious respiratory infection that's particularly dangerous for young children. It causes a fever, cough, runny nose, red eyes, and a characteristic rash. Measles can lead to serious complications such as pneumonia, encephalitis, which is inflammation of the brain, and even death. Thankfully, we have a safe and effective vaccine, the MMR vaccine, which protects against measles, mumps, and rubella. Vaccination is crucial to prevent measles outbreaks and protect those who are unable to get vaccinated, such as infants and people with weakened immune systems. Finally, let's discuss rabies, a deadly viral disease that affects the central nervous system. It's most commonly transmitted through the bite of an infected animal such as a dog, bat, or raccoon. Rabies is a serious disease that can cause fever, headache, muscle weakness, and paralysis. Once symptoms appear, it's almost always fatal. Prevention is key when it comes to rabies. This includes vaccinating your pets, avoiding contact with wild animals, and seeking immediate medical attention if you are bitten or scratched by an animal. That's it for our top 10 viral diseases. Remember, knowledge is power when it comes to protecting your health. Staying informed is the first step to taking care of your health and the health of your loved ones. So don't forget to share this video with your friends, leave a like, and subscribe to the channel for more informative content. We've got lots of other great videos coming up, including one on how to strengthen your immune system and another on the importance of vaccines. See you in the next video.